Hi, my name is Nijani Chakma.
And my name is Justin Paul Ocampo. The title of our presentation today is Visitation in the ICU.
The purpose of this policy is to eliminate any gray areas that may arise with visitation in the ICU and provide the RN with a guideline to utilize when considering multiple, which means more than 2 visitors for a terminal or dying patient.
Visitation is an act in which one sees and spends time with somebody, especially as an act of affection or friendship.
The pre-revised policy stated no more than 2 visitors could visit a patient for 30 minutes at a time, every even hour. But in certain situations, nurses were finding themselves going against the policy in order to accommodate large families in times where death was imminent.
Take a moment and think to yourself, what would you do in this situation? Now, some of you may think that this is a no-brainer, and some of you may feel a heavy burden buried deep within your chest.
Do we let the family in, or do we make them come in 2 at a time, where it's possible they may not see their loved one alive?
That's a good point, Jenny. Let's take a look at some of the statistics. Upon surveying 40 nurses at the Arrowhead Regional Medical Center ICUs, half of the nurses responded saying that they always follow the current visitation policy, regardless of a patient's current status, with the other half responding that, at times, they do go against the policy and accommodate the family.
This inconsistency in accommodation has often led to conflict in the workplace amongst healthcare professionals and even family members.
Let's take a moment to examine this picture. The conflict in this case has withdrawn the attention of the nurses away from the patient, placing patient-centered care as a low priority.
In revising our policy, we wanted to make the dying patient the center of our care. Focus should be solely on the patient and his or her needs, not on who has the right to come in and out of the ICU.
Our survey unveiled that 4 out of every 5 nurses thought family members should be with their dying loved one, regardless of the amount of visitors.
This evidence shows that the nurses, in this case, did want to allow admissions, but because of the policy were put in a difficult positions. So, our new policy is as follows. We have defined terminally ill, dying, and high-risk surgical patients as special consideration to the visitation policy.
This picture symbolizes collaboration and teamwork. The nurse of the patient being considered will then collaborate with the ICU charge nurse in assessing the situation. This collaborative effort will lead to accommodating family members as deemed necessary. If the nurse of the patient and charge nurse do find admittance of multiple visitors appropriate, it will be up to the nurse to carry through the following responsibilities.
When families gather, noise levels may be an issue. It will be the nurse's responsibility to maintain a minimal noise level conducive to quality of care and recovery in the ICU. Family members that are unable to comply with the nursing staff will be asked to vacate the ICU.
In our studies, we have all learned to be culturally sensitive. Families may have rituals, readings, or chants geared towards dying patients. It is our job as nurses to promote and respect these circumstances. Rituals high in noise level, however, should not be permitted in the ICU.
Palliative care is a very important task and may be difficult with family members in the room. It is the nurse's responsibility to negotiate one-on-one time with the patient in order to carry out nursing tasks while maintaining sensitivity to familial situation.
In conclusion, we understand acceptance of a loved one dying is hard, and family members should be at the bedside. We hope this presentation has shed light upon the conflict that visitation policies have presented in the past.
Through the guidelines outlined in this policy, we hope to enhance the family's visit to the ICU without adding more stress than already being experienced.